everybody still has their own little way of doing things that will make one surgeon different than the other. And I think that's very important in developing your techniques and your career and your interaction with the patients, because it may be the same surgery that you do over and over. That one patient is still the only surgery that they're going to have with you, even though it may be a relatively small case or uncomplicated case. It's still important to the patient, and you still should focus and take care of the patient the same way every time, and give your personal touch to each of the different patients that you're taking care of. I think that's what sets doctors apart, especially these days with HMOs and all the managed care. Doctors are forced to see a much higher volume of patients than they had to in the past, and they spend less and less time with the patients. So the doctors that could get to the patient and see them and take care of them in a personal manner, I think those are still the ones that are going to be successful going into the future.
I was diagnosed with breast cancer last year on December 23rd. So basically, I was just doing a regular checkup and then sent me to do a sonogram followed by a biopsy. When I got the biopsy, I decided to see a couple of doctors because they were saying that I needed chemo before the operation. And when I came to see Dr. Egozi, gave me the different alternatives that I had and choices that I had of actually getting an operation or getting chemo first. And he explained to me every single route that I can go with the breast cancer. You know, I think the doctor has to be like kind of part of your family because it does take care of your health. So it really needs to tell you, you know, what are your pros and cons and how you should do things. But also it's like an advisor and a consultant at the same time. It's not just the doctor, you know, that's going to give you medicine, but the human part of it. And I think that's very important. And that's one of the reasons, I mean, that was the main reason why I chose Egozi over the other doctors when I decided to do my operation.
Well, when you're treating somebody with cancer and you've cured them, or they're free of cancer and they've gotten all the treatments and they're done, you just feel great about it, and the patient feels great, and everybody kind of celebrates, and you kind of get involved in that, the whole emotional aspect of treating somebody with cancer and curing them and having them, you know, continue their lives like they were before they got into this. I think I got interested in medicine or started thinking about medicine in middle school, high school years, teenager years. I have an uncle who's a surgeon, and I was able to see him working, and he would take me into the operating room, and I was able to observe the cases that he was doing, and all that just seemed very fascinating to me. The whole procedures, the operating room, the whole concept of surgery was just very, very interesting. So after I got into medicine and started doing the different rotations that we are required to do, surgery still was the most interesting, the most fascinating to me. Just seeing somebody sick in the emergency room and doing an operation, and the next day they're fine and able to go home and they're feeling much better, just was great. A typical day, I start early in the morning, usually start surgery around 7:30, depending on how many cases there are for that day. And when I'm done with the surgeries, I come to the office. I have office hours in the afternoons usually. 3 days a week I have office hours. When I'm done seeing the patients and the paperwork and the charting and everything else that's involved with the office stuff, I have 2 kids, and I go chase after them in the evening. My wife also works in the office here, and she takes care of the front part of the office, greeting the patients, checking them in, bringing them into the office, and working on the computer, making appointments. So it's sort of like a family business. It's just very close, the whole office. I went to undergraduate at the University of Miami, and then medical school was the Medical College of Wisconsin in Milwaukee. Went there for 4 years, and then I did a general surgery residency in Flushing Hospital, which is in Queens, New York, and as well as Albert Einstein College of Medicine, which is in the Bronx. So that was for 5 years, general surgery, and then when I was done with the residency, I moved back down here to start my practice, and that was in 1992. So my practice is general surgery, and I do all sorts of different types of surgeries. The main surgeries that I do are hernias. I do a lot of breast surgery, breast biopsies. I treat breast cancer. I also treat a condition of excessive sweating, which is sort of my niche in this area. Not many people treat that. And I do try to take the least invasive method of treating the patients for any procedure that I do. I try not to do things in the hospital. If I can do something in an outpatient surgery center or in the office, painless, less invasive, that's what I try to do for most of the procedures that I perform.